updates. After those updates, we'll hear from the Red Subcommittee and discuss and decide on a proposal that they're putting forward to the board today. After that, we'll take a short break, and then the ad hoc work group members will present their recommendations, and OHA will give an update on the RFGA process. As always, we will take time at the end of the meeting to hear any comments from the public. And then we'll end by going over next steps and adjourn. We'll leave lots of space for questions and discussions through our time together. And we will also give ourselves permission to end early if our business is completed before 1 p.m. So with that, before we do roll call, I would like to welcome new board member Todd Noble. Todd will be representing a community mental health program. Todd, I'll let you say a few words about your background in a moment, but I'd like to take this opportunity to thank you for stepping into the role that Rick Trelevin filled so capably since the inception of this board. We look forward to working with you. I, in particular, am looking forward to working with you and being able to interact with you in a different space. So, if you wouldn't mind, we would love to have you just give a brief introduction so the board can know a little bit more about you as we begin our work together.
And I am not certain that Todd has joined us yet. I'm just running through the names. Yeah. Um, so it's possible we may hear from Todd and have him introduce himself another time.
Okay.
But in any case, we're
Thanks.
thrilled to have him.
I can't see everybody's name, so I apologize for not catching that. But
But yeah, no worries. I was
just
trying to go through it quickly, but it was hard. Yeah.
but we do definitely want the board to know that seat has been filled, and we'll look forward to having Todd join us soon. So with that, we can go ahead and move into roll call today. It says Zach.
Oh, sorry. Yep, that is me. Thank you.
Awesome.
Good morning, everyone. When I call your name, let me know if you are here. April,
I'm here.
Adria,
Present.
John is going to be late, and Tammy as well. Annalise,
Here.
Nick,
Yeah.
Lori,
Here, and if April wants to share baby pictures, I wouldn't hate that.
agreed. All right. Skylar,
Here, and I second the baby pictures, please.
Joanne will be joining later. Julia, Carrie,
I'm here.
Todd, joining later. Fernando. I think I saw Fernando, right?
Yeah, I'm
Oh,
here.
thank you. Sheriff Phillips,
Here.
Rep. High Fam, Senator Lou Frederick, and Judge House. All right, roll call is complete.
Zach, Judge House just let me know that she's in court today and can't make it.
Thank you. Oh, Carrie, you're
All
on.
right.
There we go.
Yep, I got it. Thanks. So I actually really love this part of the meeting. It's one of my favorite parts of the meeting where we get a chance to really remind ourselves of what the future that we're working toward looks like and really ground ourselves in this as we move forward through our business today. And I'm just going to go ahead and read it. So, Oregon's Opioid Settlement Prevention, Treatment, and Recovery Board is working towards a future in which fewer people in Oregon use opioids to manage physical or mental pain or to create a sense of belonging, resulting in fewer people with substance use disorder. This is possible because there is a robust statewide system of clinician education and mental health supports for people of all ages. If people do suffer from opioid overdose, fewer die as a result because emergency responders and bystanders are equipped and educated to reverse overdoses. People who have use disorder have unrestricted access to high quality, community-based medical treatment options, regardless of how much money they make, whether they have health insurance, where they live, their race or ethnicity, their housing status, or their involvement in the legal system. Care is coordinated and continuous when people move, whether it is from town to town or from judicial or correctional systems back to the community. Once people's substance use disorder has been treated, they have access to long-term recovery support services, including counseling, supported family reunification, employment support, etc. The board will know it has been successful when measurably fewer people in Oregon are using opioids. Fewer of those who use opioids are dying as a result, and those who are in recovery are able to live full, rich, and meaningful lives. So I try not to think about the words when I say them because I feel like this is really meaningful work. And I'm really grateful to be a part of it. And I like being able to read that every time we start this meeting. So thank you for letting me do that. With that, we'll go ahead and move on to our call for conflicts. So here is our conflict slide. For the record, I'll note here that we will not be making a decision on any specific potential recipients today. So I'll let you take a moment to read this through and then give folks a time to call out any potential or actual conflicts of interest. I gotta go outside. Okay. Okay. All right. I'm not hearing anybody chime in. So I think that we can go ahead and move on to the board business. So let's turn it over to Adria for an update on settlement happenings from DOJ's perspective.
Good morning, Adria. Sorry. Good morning, everyone. I'm Adria from the Oregon Department of Justice. I use she, her pronouns. I'm an analyst with DOJ. I've been there about 13 years. I say this for the benefit of anybody who might be joining us freshly. That said, I don't have too many new updates today, but to remind you where we are, we have 8 judgments working their way through the courts against kind of small-time manufacturers totaling $10.1 million. We've got 5 of 8 of those signed by the judge at this point. And then we are in the process of finalizing the papers for Purdue. And as soon as that is done, we will be filing those. We are in the process of finalizing injunctive relief with the Albertsons Safeway company. And that is slow going, but making progress. And then finally, we are in the midst of reporting season for subdivisions who report to us their expenditures and receipts for the prior fiscal year. And then we incorporate those reports into the annual report that we will be putting together in conjunction with OHA and at the end of the year. So that's where we are. I'm happy to take any questions. Nothing new and exciting, but just continued progress towards the end goals of the things that the irons we have in the fire. Thank you, everybody.
All right, we can move on to Tammy.
Good morning, everyone. Tammy Kelly, fiscal analyst here in the Oregon Health Authority Public Health Division. I do have some updates this month since we did not have a meeting last month. If we can go to our next slide. This table outlines all of the payments, settlement payments that have been received thus far, and all of the allocations that board has worked so hard to allocate out to the community. We did receive one payment. I have another table in the future here that I will be able to outline what that was. But this is where we stand. We have total allocated and obligated funds of 133,781,724. So next slide, please. So the allocation expenditures, we continue to track the spending from the allocations that the board has made. These allocations include automatic allocations like the tribal allocations. So whenever there's a change in the amount of expected revenue, for example, when we had some supplemental funds come in from DOJ, additional restitution, these numbers change along with that because the automatic 30% then is impacted. So these numbers have been updated. So we currently have total allocations supplied by the board of 130,061,794. On track with spending. I did see some OHSU updated their invoicing, and so it's exciting. Next month, we're going to start seeing some expenses in the research and evaluation bucket. So that's something to look forward to. Next slide. And this is the table I wanted to reference for the payment that was received. So if you look in the date column, on July 17th, there was a distributor payment received of $1,030,533. And so we've logged that. And as you look at the table, you can see that there is quite a bit of payments expected in the near term. So this is just another great reminder that the dates that are on the table are estimated dates. And so we actually track actuals. This is going to become important in the next slide where we talk about actual dates that are received versus estimated dates. So we are looking forward to another payment from CVS and Allergan and another distributor payment as well as Teva in July is expected. So we are going to be tracking that, making sure we're looking for any payments that come in to the fund. At this point, we haven't seen anything, but stay tuned and we will keep on top of that. We have remaining through June of 2027 expected of an additional $21,341,103 in change. And this may be subject to shift as we go to the next slide and we talk about doing, oh, sorry, we can stay at that slide. As we talk about accounting reclassification that happens. So if you see the note up on the right, the CVS payment 3 that was anticipated in the last biennium was actually received in August of 2025. So that's been reclassified in the fiscal year 2027. And so the amount hasn't changed. It's just simply shifted for accounting purposes from one fiscal biennium to another fiscal biennium. And so as we look at these estimated dates for receipt of payments, you see there's quite a few that are on the borderline. For example, June 30th for CVS payment number 5. If these payments are received in the next biennium, again, the amounts don't change. It's really just more of an accounting and tracking purpose that we move them from one biennium to the other. But we can still manage the budgets accordingly, et cetera. So I just wanted to call that out to the board's attention and pause if there's any questions on the fiscal aspects this month. Thank you, everyone.
Great, Lisa and Michelle.
Okay, good morning, friends. I'm Lisa Shields. I am the OHA Opioid Settlement Implementation Manager, and I use she, her pronouns, and I'm always excited to share program updates with you. So next slide, please. Since we missed July, I wanted to update you on 2 opioid settlement learning collaborative meetings. So shout out to Sheriff Matt Phillips from Clatsop County, board member, who gave a really cool presentation about how jurisdictions can build their relationships with law enforcement. Clatsop County has set a really inspiring example, and Sheriff Phillips, thank you so much for taking the time to share your work with the rest of the state. It was very appreciated. And tomorrow's Learning Collaborative will be all about data. And so the idea is to show the Learning Collaborative what we have found in terms of overdose trends through 2025. There was a report to the legislature that we are required to submit every year that shows where we're at with opioid and other drug overdoses. And I'll put a link to that in the chat. And then she will also walk the group through the overdose prevention data dashboards and other sources. And the goal of that is to help local jurisdictions make data-driven decisions and find where their local data is. So I think that will be a really popular topic. And as always, the Learning Collaborative newsletter is posted on the ADPC website, and all are welcome to join. You can contact that email in this slide, or you can just reach out to me. I'll get you where you need to go. So before I hand it over to Michelle, are there any questions or comments about the Learning Collaborative or other topics?
I'm not seeing any.
All right. So Michelle is going to give you some really exciting updates on one of the board funded grantees, Rogue Recovery Center, and there is an impact report in your packet. So if you have any time to review that, I think it'll be pretty exciting. So go ahead, Michelle.
Thank you, Lisa. Good morning, everyone. Michelle Frizzell, SUD System Coordinator on the Addiction Treatment Recovery Prevention Team within the Behavioral Health Division at Oregon Health Authority. And I wanted to provide just a little bit, just some brief overview highlights of Rogue Recovery Center's impact report that I think they published it in March. So here you're going to see some great statistics, like outcomes. I actually happened to meet with them last week. And one of the things I thought was very interesting that they shared was they noted that about 1/3 of the individuals that they're serving or about 33 to 37%, are aged 42 and older. So seeing a lot of older adults in Grants Pass. They do believe that it might be tied to a large retirement age population in Grants Pass, but not completely certain. But last quarter, some of the great outcomes that they shared were 22% of the participants improved their education, 46% improved employment, and 64% were provided with referrals or successfully linked to healthcare providers, behavioral health providers, so other supports. But they're just really knocking it out of the park and doing fantastic work. And their recovery community center has kind of just become a place where all are welcome. And it's not just specific to one population. And there's just limited support in Grants Pass. So it's really, they just kind of hit the ground running and are doing great stuff. So I wanted to share that with you.
And I'd like to add that this was culturally specific funding to serve the Grants Pass LGBTQIA2S+ community. And because they have so few recovery resources, it became just a community hub for all. And I love that. So thank you, Michelle.
Thank you. That's all.
Questions or comments?
Oh, thank you. I really appreciate the updates, and I really think that is meaningful information that you shared, and really appreciate the openness and yeah, just really good to hear the impact of the work that's happening. So thank you so much.
Thank you, Carrie.
Thank you, Carrie. And we're having a similar report from Painted Horse Recovery in Roseburg that was funded to provide services for the tribal community. And again, just like Grants Pass, it has now become just a community hub for all. And so you can see the importance of these resources. So I really hope that the board feels great about these investments because it made such a huge impact already.
Yeah, it's wonderful to hear. really appreciate being able to see the outcomes and kind of get a sense of how things are really being operationalized. So thanks again. So you all know that the Research, Evaluation, and Data Subcommittee have been meeting to discuss how to meet the legislative requirement to build data systems to collect and disseminate information about substance use disorder in our state and how to evaluate the effectiveness of the interventions that the board is funding, like those that we just heard about. So, Zach is going to give an overview of the last Red Committee's meeting where the group landed on a recommendation regarding next steps. So we'll hear about that today from Zach, and I believe Annalise is also going to support that conversation. So I'll turn it over to you guys.
Thank you, Carrie. I did want to note that Todd arrived if we wanted to do an intro now. Does that sound good?
Yes.
That sounds great. Hey, Todd, so glad to have you here. I did a whole introduction for you before I realized that you weren't here yet,
Oh,
but I'm so excited to have you join the board. We have had our paths cross at various points in our careers, and so I'm really excited to be working with you in this context. So I think it'd be great if you could just take a few minutes to introduce yourself to the board, talk a little bit about yourself so we can know some stuff about you.
okay. Well, great. You probably said something nicer than what I'm probably going to say, but so yes, I'm Todd Noble. I'm the health administrator for Lynn County, which is mental health director and the public health director. Um, I really have a skin in the game for this board. I have two brothers that are heroin addicts, one in recovery for going on 4 years now. Which basically started because of a compound fracture, and was given, 200 Vicodin. And so that's how that started. 30 years later, after family catches him smoking heroin in his car, and losing everything in his life, so I have a lot of personal stake in opioid addiction and wanting to address these issues, very, very aligned with SUD treatment. When I saw this as an opportunity, it was like, this is right up my alley of interest. That's just on a personal level. I'm just really happy to be here. I see Nick's here as well, which is nice to see my AOCMHP partner here. I'm happy to be part of the board.
Great. Thank you so much for sharing that, and definitely grateful that you were willing to step up and join us. And it sounds like you'll have a lot of great insight and experience to offer. So we're just really happy to have you join us today. So,
Happy to be here. Thank you.
all right. So with that, now I can turn it back to Zach for the red.
Thank you, Carrie. Yeah, so as Carrie mentioned, the Red Subcommittee met in July and has a recommendation for your consideration. So I just wanted to start by doing a brief recap of what was discussed at that meeting. The full meeting summary is available in your packet if you are interested. But the high level was that the subcommittee heard a presentation on the Mapping Recovery Initiative, which is an unfunded grassroots cross-agency collaborative effort that is advancing statewide SUD data infrastructure through shared staff leadership. So there's OHA subject matter experts and ADPC subject matter experts involved, and really just working to advance data initiatives that are of interest to the board. So some of those initiatives include a centralized collaboration hub, a shared data dictionary and data literacy, and then an external public-facing SUD data repository, which was something that the subcommittee was particularly interested in while discussing what they wanted to spend money on. So this effort is overseen by the ADPC Ad Hoc SUD Data Work Group, which has leadership support from both agencies and includes subject matter experts from both. And ADPC commissioners and OSPTR board members are welcome to serve as advisors to this work group. Additionally, should you accept the RED subcommittee's recommendation today, Mapping Recovery would present at an upcoming board meeting about some potential next steps and how the OSPTR board could be involved. So at that meeting, the subcommittee unanimously voted to recommend that the board dissolve the subcommittee in favor of hearing recommendations directly from that ADPC data work group as the mapping recovery process continues. You'll note that the RED subcommittee also had oversight on the evaluation funding. So the subcommittee requested that OHA develop a proposal for an impact evaluation of your investments that will also come up at a future board meeting if you choose to accept this recommendation. So that's the high level. I did want to open it up to any RED subcommittee members to provide any additional information or thoughts on next steps.
I'll hop in real quick. Oh, I think I just froze there. And Zach, you froze for a minute. I'll hop in real quick and fill in a few more. I really chuckled at Zach's explanation of this group as a grassroots but one extra layer I'll just add in here. I think this is a real victory that the RED committee did do their work. I think what we found out with the internal OHA group was that they really needed an infrastructure within OHA. And so the Behavioral Health Division Director, Ebony Clark, and the Medicaid Division Director, Emma Sando, have agreed to lead this from within the agency with me as the representative from ADPC. So we've kind of tried to create an internal structure that can then bridge across agencies. And then the commission ADPC really felt like it's really hard for the settlement board to kind of carry this weight of doing an SUD data system when we're really just this advisory board over this little slice of funding. So it would make sense for us to kind of take this on to continue it on and invite settlement board members to join us. So we do plan to meet in later on this month with the mapping recovery group to vet the proposal that they're hoping to bring forward to you all in September to leverage some of the settlement board resources to kind of supercharge this mapping recovery effort. So I just wanted to share that this really is good news. So I don't want anybody to be like, oh, the RED committee kind of failed. I think we finally got where we needed to go, and now we have a plan for a path moving forward. And happy to answer any questions.
Are there any questions for the RED subcommittee? Any concerns about this recommendation to dissolve the subcommittee and work with the ADPC data work group to review their recommendations for how to use the data system funds? April?
I just wanted to offer some appreciation for the work to put this proposal together, for the RED subcommittee's work to get here today. And for Annalise, I know you've been probably doing a lot of work alongside OHA executive leadership to really come up with this ad hoc work group to come up with the best plan for an SUD data system for that will benefit the state. And it excites me that we're moving forward with that. So just thank you.
Lori?
Thank you. Yeah, I really appreciate that this is moving forward this way with some resources that make sense. I see that it says presenting a proposal at an upcoming board meeting. That could mean a month from now. That could mean a year from now. Do we have any general sense of timeline? Are we going to hear back in 3 months, 6 months? What's your best guess at this point?
I can take that one. Yeah, so the current plan is to have a mapping recovery presentation at your September meeting and then have the evaluation proposal at the October meeting. So in quick succession.
Any other questions? And I haven't heard any concerns. Annalise, would you like to introduce the draft motion?
Sure. So I move to dissolve the Research, Evaluation, and Data Subcommittee of the Opioid Settlement Prevention, Treatment, and Recovery Board as of August 5th, 2026.
I will second that.
Are there any recommended changes to the motion? All right, seeing none, it's been moved and seconded. I think we could go ahead and vote. Zach, do you want to do the roll?
Absolutely. When I call your name, let me know how you vote or if you abstain, starting with April.
Aye.
Adria.
Aye.
John.
Aye.
Tammy. Annalise.
Aye.
Nick.
Huh?
Lori.
Aye.
Skylar.
Yes.
Joanne. Julia.
Aye.
Carrie.
Yes. Sorry.
No worries. Todd
Aye.
and Fernando.
Yes.
All right, the motion carries. Thank you, everyone.
Okay, so this is earlier than we would normally have a break, and our break is also going to be shorter than it usually is. Matt, I see your hand. But we just wanted to propose, we don't want to break up the next part of our conversation, which is the RFGA recommendations. So yeah, we're proposing this earlier, shorter break, then move into that discussion, and we might be able to end early depending on how that goes. But we'll also like see how that discussion is moving along, and if we need to take a short break during that discussion, then we will. Matt?
Yeah, my vote would be aye as well, but I was not included on the roll call.
Sorry about
Oh
that. Yeah, I just noticed
no.
that. I will record you as a yes and make sure we get that slide updated. Sorry about that.
Thanks, Matt. All right, so we will come back at 10:40 and head into our RFGA conversation. All right, welcome back, everybody.
All right. Yes, welcome back, everybody. Um, I know that break was shorter than our usual break, as Jenny mentioned. But thank you all for coming back on time. I'm really excited to transition to this part of the meeting where we get to hear from OHA and members of the ad hoc work group about their recommendations for the request for grant applications. We'll hear from a mix of Zach, who facilitated the work group meetings, OHA staff, and work group members. So with that, I'm going to go ahead and hand it off to Zach to get us started.
Thank you, Carrie. Welcome back, everyone. So as Carrie mentioned, I facilitated the work group meetings that where the RFGA was discussed over the course of the past couple months. So just wanted to start with a reminder of what you all identified as important for this RFGA process back in your June meeting and before. So those were to fund the full care continuum. Any organization that meets the RFGA requirements can apply. Broad geographic distribution, encouraging innovation, transparent and low burden application process, and reaching organizations who have not traditionally received state dollars. So those questions and priorities were kept in mind as the work group worked through the process. I'll turn it over to, I think, Lisa or Michelle to talk about the role of that work group within the overall RFGA process within OHA.
Thank you, Zach. We want to walk through the role of the work group in helping inform OHA's development of the opioid settlement RFGA. First, the work group is helping OHA better understand the board's funding priorities. This is really the foundation of the entire process. Before OHA can fully develop the RFGA, we need clarity on what the board wants to prioritize across prevention, treatment, recovery. The work group acts as the bridge here, making sure the board's intentions are clearly understood and reflected. And second, the work group provides guidance as the RFGA is being developed. This includes practical input about structure, criteria, and what the community needs may be. The goal is to make sure the RFGA is grounded in real experience and that it's accessible and meaningful for applicants throughout the state. Third, it's important to note that some details of the RFGA are intentionally not included at this early stage. This is normal and follows agency best practices. It allows OHA to start shaping the framework while still leaving space for refinement as the process continues. So if something seems missing, that's expected at this point. And finally, the RFGA draft may change once it goes through formal legal review. The Office of Contracts and Procurement and the Department of Justice will review materials, and it's very common for recommendations or adjustments to come out of that process. This step ensures the RFGA is legally sound and compliant before it's released. Overall, the work group helps shape the direction, provides informed guidance, and supports the development process while recognizing that the draft will continue to evolve through the required steps. Thank you.
That's you too, Michelle.
Yes.
Is it? I'm like, I'm like, oh, nice. Today's goal is to share ad hoc work group recommendations for the opioid settlement community grants RFGA, to also provide an opportunity for the full board to provide feedback, voice questions or concerns. And once we get a thumbs up or approval, OHA will move forward with the rest of the planning process until the RFGA opens up for applicants. The plans and timelines we will present assume that that we will reach general agreement today. So it's important we can move forward if we reach agreement today. That is, we'll stay on track. Okay, now I'm done.
Thanks, Michelle. Okay, so just a summary of what was discussed at each of the work group meetings. So meeting number 1 was on June 22nd, sorry. And in that meeting, the work group finalized recommendations related to funding tiers, award ranges, and capital expenses. At meeting number 2, the work group discussed eligibility criteria, allowable strategies, and interventions through a look at a crosswalk with the ADPC strategic plan, funding minimums across the continuum of care, regional funding minimums, and priority populations. And then at the final meeting on July 14th, the group finalized RFGA application question recommendations and refined a scoring rubric structure and OHA selection process. So that was just the overall scope of the meetings, and you'll get detail on each of these recommendations in the coming slides. So we will now start with eligible entities, which I believe is Lisa.
Okay, so we've just kind of split up these slides, and before I go into recommendations for who is eligible to apply for this RFGA, I know we just had a bullet point about the ADPC crosswalk, but let me assure you that was a very heavy lift. ADPC staff put together, looked at their entire comprehensive plan and aligned it with Exhibit E strategies and presented that crosswalk to the ad hoc work group. So really, it was so incredibly helpful. And every step of the way has been a collaboration also with the ADPC. So I just want to acknowledge that they've helped tremendously. So, okay. So here's where we're at with the planning today. Nothing set in stone. This is your chance to let us know if you have any concerns or suggestions. Everything is open to feedback at this point. And where we landed on eligible entities is basically pretty much any organization can apply as long as they are not a state agency or a tribal government. And we'll go more into that. But the reason for tribal government is because you've funded tribal governments already with the tribal set aside. However, organizations who serve tribal communities are super welcome to apply and as one of the populations of focus. So where we grouped the eligible applicants was into 4 categories. And this is more of an including but not limited to list. And so as I go through this, I welcome any feedback. If you think I've missed anything, this would be a great time to let me know. So we've got local governments or public agencies, and a few examples of those are public safety, corrections, fire, EMS, local governments, special districts. And then we've got behavioral health or healthcare providers, definitely the CMHPs and clinics, treatment providers, hospitals and healthcare systems. Emergency medical service providers can fit either into the public agency or healthcare provider category. So we just listed it as either or. FQHCs, CCOs, and then community-based or nonprofit. So definitely CBOs, also faith-based organizations, recovery centers, recovery housing, coalitions, professional associations, nonprofit advocacy, and then our academic or workforce partners. So this includes public universities and colleges, et cetera. Oh, education service districts, schools, and other academic institutions. And before I take questions, let's just go to the next slide because it has more clarifications. Okay, so as I mentioned before, state agencies and tribal governments are not eligible to apply, but they certainly may be listed as partners by applicants. We're also requiring that the applicants be physically located and registered in Oregon, and the projects must primarily serve people in Oregon. We recognize that, of course, we have several bordering communities, and that's okay, but the primary service goes to people in Oregon. And these are 2-year projects with a fixed start and end date. So we require that applicants demonstrate that they can complete their projects no later than June 30th of 2029. So the project start date is July 1 of 2027 through June 30, 2029. If a applicant has had any current or past OHA contracts, they must be in good standing. And we have a pretty careful definition of what good standing means. And then we're looking for applicants who have experience relevant to the the project subject matter that they're proposing, or meaningfully serving one of the named priority populations. And that can include staff expertise or training or other relevant qualifications, close ties to the community being served, et cetera. And then any partner organization listed in the application to implement the project must provide a letter of commitment. And a letter of commitment is different from a letter of support. It's just technically different, but it's a little less bureaucratic, I guess we could say. And the rationale behind this is to make sure that the funding reaches Oregonians, mostly Oregonians, and that an applicant has the necessarily partnerships in place and experience to successfully complete their proposed projects by the end of the 2-year period. And one more slide from me, please. Okay. Oh, sorry, I'm looking at the wrong one. Okay, so then we also have some eligibility requirements around alignment and the limitations. So all projects must align with both the terms of the settlements that we all know as Exhibit E and the ADPC Comprehensive Plan. And 5 main funding categories that Annalise will be sharing with you, but it's the usual: prevention, treatment, recovery, overdose prevention and risk reduction, and research, innovative research. So the applicants must select one of those, and then at least one eligible strategy within that category. That being said, proposers may, of course, include additional strategies from other funding categories. We just ask for our budget tracking purposes that there be one main area of focus. And we'll give you more information about that, but they certainly may provide a full spectrum of services. And then there will be a section in the RFGA where the applicant must describe how this project aligns with the ADPC Comprehensive Plan's priorities, strategies, and activities. And then each organization may only submit one application as the lead applicant, but they can certainly serve as partners on multiple proposals, but for which they are the lead, only one. And the rationale behind this is alignment with ADPC priorities in terms of the settlements, making sure that being good stewards of these opioid settlement dollars, that they are distributed to a wide range of organizations. And we heard the board's desire to reach entities that have not previously received funding. So we're working really hard to take down barriers and make sure that new organizations will have the opportunity to enter a relationship with OHA and this space. So that's where I end, and I would love any questions, comments. Did anything stand out, seem weird? Did I miss anything?
Yeah, before we get to those questions, I just want to let you know a little bit about how this next, this time that we're in, about the RFGA recommendations is going to go. So there are 10 recommendations that the work group came up with. And so Lisa just went through the first 2 recommendations, and we're going to then do sort of this question and answer time and temperature check for each of those recommendations, just so you can kind of know where we are in the process.
And I forgot that. Sorry, Jenny.
Yeah, and so I wonder if we could go back to the eligible entity slide, so slide 28. And for this moment, can we limit questions and concerns and suggestions to that question that you asked earlier, Lisa, like these are the recommended eligible entities. Are there any questions about them? Are there any entities that are missing? Fernando?
My question was about the next slide. So, yeah.
Okay, so about the eligible entities, are there any questions about these eligible entities? And if so, what are they?
And again, it's including but not limited to. So there is an other category they may select if we missed anybody.
April?
Yeah, apologize, Lisa, if you shared this already, but just in terms of policy overlap of OHA rules typically for RFGA and eligibility of I'm just thinking immediately of the like faith-based organizations, and but if there are any conflicts of interest with requirements that for the services that we would want to avoid, if that makes sense.
Oh yeah, great question. We have worked with faith-based organizations that serve specific communities as kind of a community hub, and typically like the community-based equity grants will work with these kinds of partners, but they will have to be registered, right? But like they have to have the legal paperwork in place in order to receive and track funds. So just thinking of a few examples in the past, for an older adult falls prevention strategy, we had some churches that established Tai Chi classes, or we've had many listening sessions with organizations that serve Black and African American communities, and often churches can be a hub, and they tend to do health and wellness fairs and connections to services. And so, it tends to be places that are already doing this sort of work. Does that answer it?
Yes, I think that that's sort of the more positive aspects that we would want to see out of a solicitation. I guess my concern would be around how we're the service modality, if there's requirements that, so what we've run into in the past in other contracts I held in different roles was if there are requirements for the service that include prayer, for example, or other kinds of things that maybe aren't aligned with state values, would we be able to properly, ascertain that the service modality is in alignment with best practice and values of the state?
I appreciate that. We can definitely add some language around that. That's helpful to hear. And I'm thinking about how in one of our partner consultations about this RFGA, we heard, hey, if there's let's say a proposer wants to establish a recovery center that's open after hours where people can hang out at night, have a sandwich, stuff like that. Please don't require them to hear a sermon for soup, right? Things like that. So I hear you. We'll look at that language, and I'd love to run it by you later.
Okay, any other questions about eligible entities? All right, let's go into our temperature check. In general, does anyone object to these entities being eligible to apply for funding via the RFGA? If you do object, raise your hand. All right, seeing none, and April, taking your comment into consideration, I think we can move on to the eligibility requirement slides. So that's slide 28 and 29, and ask those same questions. So Lisa went over the eligibility requirements. And Fernando, you had a question about eligibility requirements. Yeah, let's hear it.
Yeah, really just the fourth bullet point down. Project must be planned for completion no later than June 30, 2029. Do we have any thought on what will happen should the project not be completed by that date?
I'm glad you asked that. This actually for sure came up in the ad hoc work group. So any ad hoc work group members, please do chime in. But the idea is that obviously we can allow for extenuating circumstances, and OHA, we always have grantees who for some reason can't quite make it, and we'll work with them if that's the case. But we're hoping that it be the exception rather than the norm. But it's definitely a possibility, and we're okay with that.
Okay.
Also, I took out language that they must have their money all spent by that date, because that's often not realistic because they still have invoices and staffing coming in, but we want to make sure that their activities are hopefully complete by then.
Yeah, thank you for that. That's why I was asked.
Yeah.
What, having to spend money by a certain date is a really great way to ensure not a great way of spending money sometimes. So
Right. Yeah.
Thanks, Fernando. Lori?
Thank you. A quick thing to follow on to that, and then I have a question about a couple bullets above it. I agree. We don't want to require people have their money spent because of all the things that have been said and more, but we could require that they be allocated, if not actually appropriated. That
Yeah.
the budget accounts for them to have been used, even if they haven't put the money out the door by that date. My concerns are in 2 and 3. I would love to hear more about, physically located / registered in Oregon are 2 very different things. Primarily serving people in Oregon, as opposed to that the funds are used to serve people in Oregon, is also different. I understand why we might have regional entities that are serving people in multiple communities, and that's why we're not just saying you have to be strictly Oregon. But I wonder if we can tighten those 2 up a little bit.
Sure. We have wrestled so much with this, and I'll tell you the rationale behind this, and I would appreciate any help tweaking this language. It's about we've had several national organizations reach out about this funding, and knowing that it's a very limited pot of money and wanting to make sure it benefits our state. We knew we had to put the ad hoc work group knew they had to put some kind of guardrails in this. And so we're not saying physically located or registered. It's physically located and registered in Oregon. So if it's a regional or a national organization, they must have an office in Oregon and registration in Oregon with the Secretary of State. And then primarily serve people in Oregon. We were explaining it as serve people in Oregon, bordering communities are okay. I would love ideas on how to tighten that up, Lori. What were you thinking?
Well, I guess to the other one, is this truncated for the purposes of a slide, and that will be more explicitly articulated, the located and registered, in the actual proposal request. Okay, that's helpful. Thank you. As far as the primarily serve people, I'm not averse to an regional organization that wants to start having serve people in Oregon with these funds were awarded to the state of Oregon based on the work of people in Oregon applying and becoming part of the interstate compact. So it's just really important to me that the funds serve Oregonians. So again, maybe there's going to be a little more articulation. And I also don't know, we haven't gotten to talking about, is it just a yes, no? If you check the box on these, you're eligible. Will there be weighted scoring so that could be a place where an entity that has more or less of a footprint, or how many Oregonians versus the dollars could potentially be used to serve folks outside of the state, will be benefiting? I mean, I know we want to address this issue is the same issue nationally, but I just feel a certain obligation to make sure Oregonians who are benefiting from these funds.
Great. I'm really glad you're bringing this up right now. I'm just thinking of ways to address this. The intent of this, nothing is set in stone, is part of the initial eligibility screen. And if they can't answer yes to all of these, they're not allowed to apply. And if this feels too restrictive, we can absolutely soften that up.
So Joanne has a question about cities meeting the eligibility requirement.
Yes, any local government, including cities and counties, special districts. And I'll just say it, we're expecting a flood of applications. It's a really tough environment out there, as we all know, and it's getting worse. And that's why the ad hoc work group has really talked a lot about, well, what are the guardrails? I would love, if there are any ad hoc work group members that want to chime in, I would love to hear from you.
I was just going to hop in to support and emphasize a few things. I mean, This is a small bucket of money. It is one-time funding, and we'll continue to talk about this. Big kudos to OHA for kind of constantly reminding us through the work group process. And I see Sheriff Phillips has his hands up too, so he can pitch in that, we're going to get a lot of applications. So thinking about how to prioritize on the front end so we don't have people applying who are wasting their time, etc. We don't need to cast a huge footprint. We have plenty of organizations in Oregon who are doing this good work. I also think of this as the way from the very beginning as a board, we have thought about really supporting the system we have. Yes, filling gaps, but not standing up a whole bunch of brand new things that maybe we can't sustain, especially with this that's one-time money. And then also just want to remind everybody this is a summary, and this goes through the whole contracts and procurement process and goes through DOJ for legal sufficiency and all that kind of stuff. So it has a long, arduous process ahead of it.
Matt?
Well, I just wanted to touch on projects must primarily serve people in Oregon. I'm one of those counties that's on a border, and community doesn't always respect geographical or political boundaries, I should say. And so, like, there's so many families that half live in Astoria and half live in Nassau, Washington, and our CBOs primarily serve Oregonians, but aren't going to refuse services to someone who lives across the river where there's way fewer services. And so, I think that it's appropriate to say primarily serve people in Oregon.
Thanks, Matt. All right, any final questions about the eligibility requirements before we do our temperature check?
Lori, I like your language about grant funds must be spent in Oregon. I think that's a nice addition if the ad hoc work group and the other board members like it.
It sounds like Fernando is giving that a thumbs up as well. Fernando, is that essentially the point you were going to make?
Yeah, so that sort of kind of makes it so that if there's an organization that is meets criteria that's national, but it's physically and locally registered, meets all the criteria, but they still have to be told, no, no, but you still do have to just spend this particular money in Oregon. So
I think that's a really good way to address this. Thank you.
Thanks all.
And this isn't your only chance for feedback. As Jenny mentioned, we'll after all of this, and you'll have time to think about it, we'll have time to come back and talk about it more.
So with that addition, funds must be spent in Oregon, and with some of the explanations from Annalise and Sheriff Phillips, how do we feel about these eligibility requirements? Does anyone object to these recommended eligibility requirements? Raise your hand if that's the case. All right. Not seeing any objections. I also, just a quick note for everyone, I'll just say this out loud. Members of the OSPTR board are welcome to ask questions, raise concerns, either out loud or in the chat. Members of the public are here to observe, and but we do welcome the board, I should say, welcomes public comment either during the public comment period or in writing to OHA staff. So, and those comments are included in the official summaries of the meeting. So I think Michelle Oster noted that if you do have would like to make a public comment, then please let them know via the chat by 11:30. And with that, let's go ahead and move on to allowable strategies. Annalise?
Okay, and please let me know if I freeze or something because I feel like I'm a little laggy today. So as Lisa mentioned, we started with the core strategies. So you remember in our prior discussions, the board did give a thumbs up to limiting because there's the wider Exhibit E allowable uses and then there's the core strategies. And so the ADPC team went through and aligned the comprehensive plan strategies that we should be prioritizing for the next 5 years with the core strategies. And then also pulled in some of the allowable uses, I will say, particularly as it relates to harm and risk reduction, since we already have a lot invested in naloxone. We really tried to pull in the broader use and the strategies there. So there's also, I'll just say one more kind of introductory thing as we go into this. As part of the ADPC plan, we have a whole section on infrastructure, looking at financing and moving to sustainable funding. And there are some recommendations that I believe I brought to you all before about really prioritizing this funding for things that we can't fund with other resources. So that was also this lens as well, where there's no real source for some of these things. And so this is kind of area by area as we've done before to ensure that we have the full spectrum. I know we're already getting some questions about, why are you breaking it down by continuum of care? It's really because we as a board have this principle that we want to be investing across the continuum of care, that's part of building a recovery-oriented system of care. But as Lisa mentioned, that's also why in the applications, folks can have their optional second categories. That's something I think we've all heard from, especially our culturally specific communities and communities of color, that really having kind of a more holistic approach. So all that said, primary prevention strategies, strengthening school-based prevention and intervention, in particular, implementing, for folks who don't know, under Oregon rule, every school district is required to have a substance use prevention and intervention plan. That's something that's been implemented to varying degrees across the state. So something that really, it could be a community partner, it could be a school that promotes that and lifts that up in the school district. Improving school capacity to identify and respond to co-occurring behavioral health needs under that school-based bucket. Supporting policies that promote early intervention and protective factors. So this is pretty broad. I'll name that, but given how little funding we have for primary prevention and how far we kind of have to go, our recommendation was to have that in there. Advance equitable and supportive school discipline practices. So something we heard particularly from our youth-led folks is programs and implementation of policy locally to promote the adoption of non-exclusionary school disciplinary policies, so that we're really emphasizing an off-ramp before kids are referred to juvenile justice or higher. Next slide. Are we going to go through kind of all of these, or are we going to pause? Okay,
well,
great.
We can pause at any time if people have questions. But yeah, in general, we're going to run through these 10 slides.
Okay. Yeah. So a note on naloxone purchases. Maybe this is because we're going into harm reduction next. Our recommendation is to not include naloxone as an allowable expense because we have already allocated funding to Save Lives Oregon. So really promoting people to do their purchases through there. We're really trying to promote efficient purchasing of naloxone. We're hearing in the community that we're at a really good level of spending for Save Lives Oregon, which feels really good. I think people feel good about it. So that'll be something for us to think about. However, the funds can be used for naloxone distribution and education. And I think you'll see on later slides, especially if it's part of a comprehensive harm reduction approach. Next slide. Okay, eligible overdose prevention and risk reduction strategies. So expanding access to overdose prevention tools. So as we said, naloxone distribution and education. One of our priorities in the plan is to expand access in communities that do have low access to naloxone. I know there's also some rural health transformation money going there now. Safer use education, risk reduction supports, connections to wraparound services in healthcare. And then another big opportunity here that we've seen some other states invest in this is to strengthen drug checking and information sharing. So as part of the comprehensive plan, this is something that our commission has really emphasized, that we need better connections of sources of information about our drug supply for drug users themselves, for providers, for all of us to understand how to respond to this. This is something I hear from like our partners at the High Intensity Drug Trafficking Agency and Oregon State Police, that we're trying to connect some of these. It really needs to include, though, a community strategy, perhaps wastewater testing, with street level drug checking as well. And there's numerous ways to do that. So that is something that we emphasize in the plan, that we really need to move forward as a state, and strengthening those communication pathways within communities so that the folks who need that information are getting that information. So enhancing harm reduction services across settings. This is another thing that is in the allowable uses that we lifted up as crosswalking with the comprehensive plan, providing or expanding mobile or fixed site harm reduction services, expanding strategies to not just CBOs who might be primarily doing that, but other community safety net providers like syringe service programs, community-based organizations, FQHCs. Improving communication and public understanding. So developing communication tools that clearly explain services, provider roles, the partnerships necessary. And then finally, expanding training and workforce capacity is something that is an allowable use. So given that it's one-time funding, could be helpful for risk reduction training for healthcare workers, social service staff, and community members. Next slide. Treatment strategies. This is a big one. I mean, there's a lot of uses of the allowable uses of the funds and core strategies that have a huge overlap with our treatment strategies. As a reminder, the comprehensive plan is really looking at increasing initial access, equitable access to services. So really getting folks or communities in places that don't have access, transitions through the care process, as well as evidence-based practices. So this is a pretty big list. I'm not going to tick off everything here. I think we have probably most of what's in the core uses is supported by the comprehensive plan. There are some focus areas in the comprehensive plan, ensuring access to withdrawal management statewide, which might not necessarily include adding a physical location, but maybe transportation, same-day transportation to withdrawal management, transition out of withdrawal management, access to medications for opioid use disorder or substance use disorder in carceral settings is included. And it includes in the allowable uses jails and specialty courts. So I will note that's a part of the comprehensive plan we don't talk about a lot, but we've been working with the specialty courts to really improve access and stigma around MOUD. Emergency departments and EMS, we're seeing a lot of work here in Oregon around that. That's an allowable use of the funding that still not available statewide, so that would be a great use. Strengthening access to evidence-based therapies, which could include developing programs, promoting framework, developing care models, supporting implementations of practice where we have a lower adoption of fidelity models. All of that's an allowable use that tracks to the comprehensive plan. Next slide. Strengthening co-occurring and specialized care is also something that is called out in the allowable uses. So expanding access to services and training for co-occurring mental health and substance use disorders. And then this is a big one in our plan. We need to move forward is really delivering culturally specific and place-based sub-treatment and care to high-need populations, such as pregnant and postpartum, rural and remote communities, or other priority populations listed in the RFGA. Pregnant and postpartum people are called out separately in approved uses. So that's something for folks to know. And we've included that in this list of allowable uses. Next slide. Improve, and as I said, kind of this is tracking a little bit, improve care coordination and treatment navigation. So there is some of this kind of infrastructure that is allowable uses. I will say we did wrestle and with OHA and with ourselves over what is kind of a statewide thing, what is local. We had clear feedback from particularly our youth community and our families that developing these resources regionally would be really helpful. So having more centralized resources for youth and family where all your leaders in your community are aware of that, improving referral systems through the continuum of care, better coordinating that in communities, and supporting transition planning for high needs populations, especially folks who have culturally specific needs or specific language needs. That gets even more complicated. So those are all allowable uses of the funds. Next slide. Treatment just goes on and on, as I said. Sorry, I'm talking fast, but I think we can, I don't know that there'll be any surprises or anything left off in treatment. Increasing workforce capacity and provider support are also allowable uses. Increasing access within treatment to peer-delivered services and or in-home treatment are something we emphasize in the comprehensive plan. Developing training and education for staff in carceral facilities. So this has a little bit of an asterisk on it. There's a lot in our comprehensive plan about improving our continuum of care in our carceral system. And sometimes that does need to be something that is led by Department of Corrections or the Oregon Youth Authority. But in many cases, it's something that a community-based provider can partner with them. That is something that we would expect an applicant to have them as a partner, even though the state agency is not allowed. We're not asking people to come up with ideas that the agencies have not asked for, to be very clear there. Strengthening the capacity of smaller and rural providers to participate in data collection and use data-driven decision making. I really love that one as a way to use these one-time funds to improve the infrastructure in our system. Next slide. Might be done with treatment. Yes. Okay, that was everything on treatment. We're almost done here, so I'll just keep going. Under recovery strategies. Oh, looks like Lisa has a question, or April. I'll stop.
I did have a question, but I can hold to the end if that was your preference, Annalise.
It's totally up to you. Is it about treatment?
Yeah, it was more about, I just, the use of one-time funds is always going to be a question, right? So when we talk about increasing access to peer-delivered services, how are we imagining one-time funds helping with that? Is it like maybe through training grants or something? But I guess I'm just trying to wrap my head around a little bit of that, where we don't want to set organizations up with building infrastructure that we don't have ongoing funding for, right?
I think your question is probably, I don't mean to deflect my governor's office friend, but I think that's a really big policy question that depends on a whole lot of levers right now. OHA is in the process of amending some rules related to COA that will improve that long-term incorporation of peers into treatment settings. I think there's a bunch of levers there that are happening all at once. So I don't feel like we can say there is no future path to funding, because there is a path, there is funding right now for it. And so it could be used to begin to bring peers, for instance, into emergency departments, or, various ways of incorporating peers that we know that there's an on-ramp to funding, but to bringing them in to start. I think this comes later, but there is a component of the application, I believe, about sustainable funding and what is the nature of the one-time funding and what will it look like after this. But that is not a part of this part. Commissioner Trigger, did you have a question about that, the one-time?
The last thing you said pretty much addressed it, that if somebody's using one-time funding for what is an ongoing expense, what's their plan? So thank you.
Yeah. It's always a tough thing with everything in this space.
Yeah, but as I think Joanne said in the chat, like sometimes startup funds those are the one-time funds, and then there is a plan or there's a reimbursement that
yes, Courtney just put, yes, there's a question in the application about sustainability.
Great.
Yeah. Okay, so recovery services in the comprehensive plan are, I'll say this because it kind of follows here, pretty clear. Establishing definitions of recovery housing and establishing sustainable funding. That is a priority of the comprehensive plan for us as a state to work on over the next 5 years. Recovery community centers and recovery spaces. And again, figuring out the sustainable funding, et cetera, for that is a priority. And then some of these peer questions are also a priority. And so what really mapped to the allowable uses was recovery housing options. And again, it is one-time funding, right? I think we have seen our initial investment pay off in one-time funding to Oxford House. Right, so this is one-time funding for this purpose. It shouldn't be used for ongoing funding, but that is an allowable use that's being put in here. And then increasing recovery spaces and community supports. You heard earlier about some of our initial funding that went to a recovery community center. That is something I will say we're doing some infrastructure work around that hopefully can be incorporated into the settlement board's work. We have a definition of recovery community centers. That's something that doesn't exist in statute right now. Our youth-led group, the Oregon Youth Addiction Alliance, has developed a youth-specific portion of the definition and best practices for recovery community centers and spaces that serve youth. So that is something that if there are projects getting stood up with this one-time funding, we hope it will align with those definitions and data collection in the future. Recovery spaces, I won't go too deep into this, but that was included in the comprehensive plan as a strong need cited by youth in particular. Having a recovery space, for instance, in a school or another shared space, and then also in our carceral settings. Next slide. Oh, right. Okay. So this is similar to what I said. So strengthening youth support and community-based alternatives to support youth and recovery. Improving community understanding and reducing stigma is something that's kind of a broad category that is listed in the approved uses. And so we tied that more specifically to implementing education and outreach initiatives to reduce stigma around recovery housing and providing education to landlords. That is a very specific piece of our recovery housing strategy that we could leverage settlement board funding for that space. The allowable use of providing support and quality improvement education for the peer recovery workforce itself. So that is something, as I mentioned, there's kind of the 3 big goals of the recovery comprehensive strategy. And the third really is supporting our peer recovery workforce. It grew very big and very quickly in Oregon, and really starting to think about quality improvement training, supports for the peer recovery workforce, best practices in different settings. Next slide. And then for research and evaluation, big thanks to Lisa. She and I kind of went back and forth on this, is to, I think this has been important to the board, but it is one-time funding. There are a number of the research and evaluation is kind of a broad category in the approved uses. So what made the most sense was to allow applications for research and evaluation that relate to the strategies that we have in here. And so that hopefully will narrow down the research and evaluation a little bit. I think as we know from our prior rounds with research and evaluation, there's no shortage of great projects out there. But if we're going to choose these strategies that we need to focus on for the next 5 years, it makes sense to have our research and evaluation match up to those strategies as well. And I think that's it.
I think that's it. Nice job, Annalise. That was a lot of slides to go through. It was a lot of information for you all to hear as well. But the general theme is that strategies that align with the ADPC comprehensive plan are eligible for funding. So does the board have any questions or concerns with that? All right. Does anyone object to alignment between the comprehensive plan and the allowable activities in the RFGA? Raise your hand if you do. All right. Okay. So I promise that for the next several recommendations, there are fewer slides. So I really appreciate Annalise for really walking us through those. Fernando, before we get started on the next one.
Yeah. Sorry, really quick. I'm just one quick word. Funding must identify one. Could it be at least one, or can people pick more than one category?
Yes, I'll refine that language. It
Okay.
should say at least one. Thank you, Fernando. At
Thanks,
least
Fernando.
we'll make it the same as the others, which is select at least one funding category and associated strategy, and may choose other strategies. Whatever. We'll fix that. Thank you.
All right. So in our next slide, John is going to talk to us about the recommendations regarding funding tiers. This is recommendation 4 out of 10, just so you know where you are. John, take it away.
Great. Thanks, Jenny. And hi, everyone. So as opposed to, I guess, content or activities, just going to focus on a little bit of the logistics or the process. So with the RFGA funding tiers, as Jenny mentioned, and we think back to our board meeting in June, was to have 2 funding tiers. Tier 1 for smaller grants, obviously to encourage capacity building and impactful work in smaller organizations, communities, excuse me, and a tier 2 for larger grants. So the tier 1 grants would be capped, as you see there, at 75,000. And the tier 2 would be capped at 500,000 with a floor of 100,000. So there's a clear difference between the 2 tiers, and also capped to ensure reasonable spend down in the 2-year project period. Again, the hope is that the tier 1, the tiers are kind of designed to get different types of solicitations for activities. Tier 1 seems like kind of a good range for it to fit into a smaller project, or maybe a shorter term project, without actually then having to compete against a large, huge organization or much larger organization, where it might not be kind of an equal standing in terms of things like experience, getting grants, doing projects of this size. So.
Thanks, John. Are there any questions about the work group's recommendation about tier 1 and tier 2 funding? Any concerns about these limits or tiers? All right. Are there any objections to the work group's recommendation related to the funding tiers? Okay, hearing none, we'll move on to recommendation 5, which is capital expenses. Also, John.
Okay, perfect. So capital expenses, as we discussed in our group, there was a pretty universal consensus about being supportive of organizations using grant dollars for capital projects, including, as you see there, vehicles, equipment, and building renovations. Part of the reason for that also is that they are not subject to the same kinds of administrative barriers as, for example, construction or the full purchase of a building, which we've talked about before, things like the covenant and the like. This model, we think, will have more flexibility. I'd echo what Annalise said, though. All of this, I think it's important to recognize, all of this, will be continued to be reviewed from a legal perspective of what can and can't end up in that, according to the guidance from DOJ or others. So just kind of that caveat. But I think this is done. This should be allowable, and I think it works for the model that we're talking about. And also with the little addendum of no cap for the tier 1 projects. So and then capped at 250,000. So a max of half for the tier 2 projects. That allows capital purchases while still leaving significant funds available to support programming and services. Just kind of off the top of my head, I'm thinking about what Annalise said about things like not advocating for one thing or the other, but drug checking devices, things like that. These are expensive. There's a lot of sort of tools and infrastructure that has more flexibility than purchasing a building, but could be really valuable to an organization that has a certain mission or a certain goal in their project. They really need that money to invest invest in something material that's going to help them get there. So again, just to summarize, lower barrier, capital purchases, less administrative challenges, but also ensuring enough money to invest in workforce or whatever else is needed to complete the goals of the stated project. So,
Thanks, John.
Sure.
All right. So, any questions for John or other work group members about or OHA around capital expenses and these recommendations for capital expenses? Any objections to moving forward with these recommendations?
I wanted to ask one clarifying question.
Yeah.
The cap on the larger awards, would an entity be eligible to apply for a larger amount as long as they're only applying 250 of the request to a capital expense? Is that the idea? Or would the entirety of their ask be for a capital expense capped at 250?
I can answer that.
Oh, go ahead, Lisa. That's a great question, Lori. Thank you.
There was much discussion in the ad hoc work group about this. So the ad hoc work group wanted to make sure that if an organization wanted to apply for a capital only project, like for example, let's say a harm reduction organization wants to buy an expensive piece of drug checking equipment, like a mass spectrometer, they could definitely do a capital only grant proposal. But it's still capped at $250,000, and they're certainly not required to apply for the full 500,000. So any capital request goes into tier 2 if it's over $100,000. Does that help?
Yeah, but they could apply, for example, for 300 and say we're going to use 250 toward this capital.
Yes.
Another 50K towards whatever. Okay.
Yeah, and the group might have more to add, but they wrestled a lot with this. Like, are we going 50% of any award? And then it switched. Let's just make it a flat amount. Yeah, there was much discussion around this.
Great, thank you.
All right, not hearing any objections. Thanks, Lori, for that clarification. Not hearing any objections to these recommendations. I think John will tell us about the work group's recommendations about priority populations. So we're on recommendation 6 of 10.
Excuse me. Thanks, Jenny. Again, this slide is just talking about a little bit about priority populations, and the board, the work group was pretty, and I've actually said this in previous meetings about the need to help support our culturally and linguistically tailored interventions and programs that exist within the state. And you can see some particular ones that are called out there: Black and African American communities, older adults, youth, immigrants and refugees, rural and remote communities, people transitioning or impacted by the legal system. We're in obviously everybody knows, I think most of us know we're in a very precarious funding environment in general. And, quite frankly, a lot of these organizations are unfortunately, I don't want to use a strong word like targeted, but really, really under the spotlight right now. I can, say that through working with the federal grants, and many of you actually work with me and other colleagues on. So this is a very, very real thing, and I think it's important that the board wanted to make sure that we put a priority on these funds, like we've talked about, are for Oregonians, to serve Oregonians and to serve all Oregonians. And we know what great work some of our culturally and linguistically specific providers and programs do in Oregon. And so, this is just kind of share that we wanted to establish. It was proposed to establish 1.35 funding minimum that's for projects that specifically serve Black African American communities. That notwithstanding that, all projects have to meet a minimum scoring threshold to follow with the guidelines of a proper RFG. And again, it also aligns with the legislative intent for the original construction of the board to be informed by the input the board receives from the public and equity considerations for underserved populations. But it also maintains that balance of ensuring that only high-scoring projects will be considered to fulfill funding minimums. And I would just also highlight, and Jenny, you have to let me know if that's going to happen today, I believe, or that's just in our packet. I think we have public comment about people experiencing houselessness. So that might be also something that we might want to think about if that's something that we'd want to incorporate into this as a board, or building off what the work group has currently kind of proposed and done here. So.
Yeah, I think a question that that the work group members had was, are there any priority populations that are not listed who should be considered?
Right.
And this is an opportunity, as was brought up in that written comment. This is an opportunity for to share those ideas so they can be taken into consideration. Fernando?
Well, I'll take that opportunity then. And I'm wondering, is there any reason why we haven't called out Latino communities, or I see immigrants there, but as a whole, immigrant communities are different and their needs are different. So yeah, I'm wondering, can that be included?
It can absolutely be included. No specific reason. Honestly, when we were looking at the data, we were looking at primarily overdose deaths, but you're absolutely right. If a lack of services, culturally specific services for a population is just as important. So I'll defer to the board's wishes, but yes, we can add or subtract anything right now.
Yeah, and I'll also say, while I understand the establishing a 1.35 funding minimum for a specific community, that does open the door to, well, what about this community? And what about this community? And what about this community? So I would just hope that this board is ready to confront that sort of conversation.
Thanks, Fernando. I'll let Lisa chime in, but a fantastic point, and that was discussed. As everybody in that group remembers, or we've had that discussion at OHA. So yeah, I mean, more to come. I would point out what Lisa said. I think it was a very, and this is obviously why we're here to talk about this in an open forum and to get feedback. It was very much, I think, driven by the disproportionate impact of opioid overdose and opioid overdose mortality on Black Oregonians, essentially. So that was where it comes from, but I don't think it's exclusive, if that makes sense. And that's obviously more discussions made, because I think you make a great point about the Hispanic and Latino community, and a focus on that too.
Yes, and the reason OHA was recommending establishing a funding minimum for Black and African American communities is because they are currently experiencing the highest rates of overdose in Oregon, and fatal overdoses, and also have, in terms of priority populations, have received the least amount of focused funding to address these disparities.
Thanks, Lisa. Joanne?
I like the priority populations description. My question is about the second bullet, and that is, while I don't think this is a likely scenario what happens if we cannot meet the 1.35 million funding minimum? What happens to that money? Will it just sit aside or will it be distributed to other areas? So does it end up being a priority or a mandate?
I think it's more of a priority. So obviously the scores still apply, the eligibility requirements still apply. And Courtney might have be more up on this, but I think obviously the plan is definitely to get the $13.5 million out the door for sure with this opportunity. And I think we're planning to have language like the will be redirected, something like that, towards other eligible projects. Do you remember anything about that, Courtney?
Yeah, that's correct, Lisa. Hi, everybody. Courtney Fultnier, she, her pronouns with Oregon Health Authority. We've run into this with past requests for grant applications as well. And so we do have language that will incorporate in the RFGA that will give us flexibility if we don't receive enough applications that reach that funding scoring minimum, then we will have flexibility to redistribute those funds that were kind of set aside for a specific population. And so the most important thing will be that funding minimum and ensuring that we're only funding high quality applications. So if we don't reach that, it will be distributed to other populations.
And also, I'd like to add that this is all pending DOJ review. So we'll keep the board posted about how these plans progress if the board agrees that this is an approach that aligns with your wishes for this money.
Okay, so adding Latino communities to the priority populations is something that was mentioned. Any other priority populations that look like they're missing here? April?
Jenny, I would like to propose that we move the priority populations conversations till after DOJ review. And I think we should talk about going back to what data is informing our priorities would be really helpful. So maybe the committee can come back to us with that soon.
OHA, do you have any thoughts on that?
Yes, all of these populations come from a mix of things, but we shared overdose and disparities data with the work group, and I can paste a link or somebody from my team can paste a link to our overdose disparities fact sheet. So that's part of the picture. Also, relying on that older OHSU gaps analysis in terms of lack of access to services. And then also the priority populations identified in Exhibit E. And that's the section where it's people in and transitioning out of legal or correction systems, pregnant and postpartum people, and infants and families impacted by neonatal opioid withdrawal syndrome. So it's from several sources. And we have drafted a rationale section in the RFGA, and I'd be happy to send out that draft language right now to board members, and I welcome your feedback.
This is Courtney. I also wanted to mention that we don't really know at this point what the timeline will be for DOJ review. And so I guess, want to call out that there is a potential risk that if the board chooses to wait to kind of like come back to be able to convene and discuss and come to final agreement on priority populations following DOJ review, it could potentially delay the RFGA timeline just kind of based on our monthly meeting cadence. We can certainly do that, but I just did want to express that potential risk before we move forward.
So Lisa, what I'm hearing from you is that there's a lot of data to support the priority populations that the ad hoc work group is recommending on this slide, for example. And is that what you were saying?
Yeah, and this is the ad hoc work group, of course, wrestled with this because, quite frankly, every population in Oregon is experiencing gaps in access to services. We know that, we have very broad gaps, and we're slowly working on that. But there are communities that are experiencing more disparities than others, and so that's an attempt to call that out. Happy to revise as needed.
And Sheriff Phillips, I see you just came on camera.
Well, on my screen, I've been on camera the whole time. I feel like the original language, to me, is the best fit because it was based off of data that showed that those groups that were listed were at the highest risk. I would propose we go back to the original language, and I do believe that most of the applicants have culturally responsive programs and that are competent. So I would hope that these entities can provide good services to everybody. And Jenny froze.
Yeah, no, I didn't. I don't think I froze. Did I freeze? Am I frozen?
You're moving now.
Okay, good. Okay, so you're suggesting removing the Hispanic and Latino communities language.
Sounds harsh, but yes, based off of data that we made our original decision and conversation centered around.
Okay.
I don't want to dilute the services to the other groups that were identified as having the greatest need.
Fernando?
I just want to be clear that what we're saying is that we are going to exclude as a priority population the second largest demographic in the state. Okay. Just wanted to have that on record.
I mean, I think you could potentially say more, Fernando, but Annalise?
So I'm going to try and move us forward here. If I'm reading the room and just thinking of my own concerns, so I do think we can show vast disparities in the Hispanic and Latino communities. So I'll argue that's a good add in that first bullet. I'm wondering if I don't want us to get into a situation, as Courtney said, where we have to spend like months more on this because DOJ determines something is not legally sufficient. So I'm wondering if, I think the riskiest is the funding minimum. And so I'm wondering if there's a way for us to move this forward with some kind of caveat based on that the evidence supports prioritizing these populations. I will say the settlement itself does have priority populations. So that feels okay. But that we could maybe move it forward, assuming evidence supports the priority populations and that it meets DOJ requirements and legal sufficiency.
I'm wondering if we could say something like, well, first of all, it's not a lot of points. When we ran our draft scoring rubric through equity review, it's recommending maybe one additional point just to not unfairly bias the scoring. So we could say something like, so entities serving any community impacted by SUD overdose are encouraged to apply. Additional points will be awarded to proposers that serve disproportionately impacted populations, including but not limited to. And then we could have a list, something like that.
How does adding that including but not limited to language sound?
I'm just going to jump in. I think that's the language that a lot of our legal authority is kind of telling us to do at the city level, especially with city attorneys, and then also talking to DOJ. So I think that really helps, and just make sure we're in compliance with the executive order.
Thanks, Guy. Joanne?
I just don't know whether the inclusion um, of the not limited to makes it more difficult for whoever's going to be reading and scoring the applications. Because I think anybody could probably make the case that this is an underserved population. So I'm just concerned about the scorers and whether that's going to make it really more difficult, even though we're only really talking about a small number of points. So the more specific you are, the easier it is for the team, the scoring team, to decide on the points.
OHA, do you have thoughts on that? On how adding the disproportionately impacted, including but not limited to, will impact the scoring, the difficulty of scoring.
Zach, can you refresh the slide? I just changed it to such as, which I think is better.
Jenny, I think that we probably need to regroup with our contacts at the Office of Contracts and Procurement and also the Department of Justice before we can really kind of answer some of these questions.
And maybe the language needs to be something like additional points will be awarded to proposers that can demonstrate meaningful experience with serving some disproportionately impacted communities, something like that. But yeah, this is feeling sticky and we need legal consult.
Okay, so we will move on from this slide, from the question of priority populations, and address that later.
Jenny, sorry to sorry to interrupt and jump in before you move on. I will just say I think that something that we can do is commit to doing that consultation and coming back at the September meeting to discuss this further.
I like that.
While continuing to move forward other parts of the RFGA. Okay, so let's move on to funding across the continuum. This is recommendation 7 of 10, and Sheriff Matt Phillips is going to present this slide.
Okay, so it's always been a priority that we spread the funding across the care continuum. So that is the primary prevention, overdose prevention, and risk reduction, treatment and recovery. And so for the tier 2 projects, we thought about it a lot, wrestled with it, and came up with a 1.4 million funding minimum for each of those elements of the continuum. And I'm sure there could be good discussion about the 1.5, but I think we discussed that units of treatment might cost more than a unit of treatment for prevention. So that's what we came up with. And of course, all the projects are going to have a minimum scoring threshold. And it looks like there's a question. Hand up.
Yeah, Joanne?
I'm sorry, I just didn't take my hand down, so I'll take it down.
Are there any questions about, so the ad hoc work group looked at different mechanisms to ensure funding across the continuum, and this is their recommendation. Are there any questions or concerns about this mechanism for ensuring funding across the continuum? Are there any objections to this recommendation from the board, from the ad hoc work group? All right. I think we could go to the next recommendation, which is about how to ensure statewide coverage. And Matt, this is you as well.
Yep, we definitely wanted to ensure there was statewide coverage, especially for the rural areas and counties. And so we proposed that there's at least one Tier 2 project within each of the OHA Healthcare Coalition regions. And again, all of the projects would need to meet the minimum scoring thresholds. And, that's a pretty simple slide.
Yeah, pretty simple. Any questions for OHA or the work group members about this recommendation for how to ensure statewide coverage? Okay, any objections to this recommendation from the ad hoc work group? All right, seeing none. April?
Not an objection necessarily, but just a question in terms of best use of resources. If we know that, or maybe moving with the guiding light of need for most need, but if we know that some regions are more saturated with services than others, how did the group discuss and or come to the decision that we wanted to distribute the larger scale investments as equally across the state as maybe driven by other need-based data?
I don't think we had a perfect solution for that. And one thing I know that I'm still concerned about is some regions are heavily dominated by urban areas. And then, you can move to region 6 that really doesn't have an urban area. So how do we ensure that, like, say, region 7 has Bend and probably more resources there than, say, Burns and Harney County? I would hope that there's enough applications in the more rural areas that we can be sure to fund those as well.
This is Courtney, and I can jump in with a little bit more information too. And so this is really just proposing that at least one Tier 2 project is located within each of these regions. And so I don't necessarily think that we anticipate funding would be evenly distributed across these regions. And I'll also share that, and this will be in future slides as well, that the hope is that by setting this kind of funding minimum for the regions and then also potentially, I guess, prioritizing rural and remote communities as a priority population would help support distribution. And then the application questions themselves will include components around describing community need. And so I would anticipate that some of that will sort of come through the project narrative questions that will be scored through the scoring rubric as well.
Which Courtney is going to be going over shortly. Okay, so knowing that that those rural populations are a priority population, and there are going to be questions in the application that address that as well, or allow people to address that as well, and that this mechanism is about ensuring that one large project at minimum be in each of these healthcare coalition regions. Are there other questions or concerns about these recommendations? Any objections to this recommendation? Okay, I think that in that case, we can go ahead and move on to the review and selection process recommendations, which is our second to last recommendation that we'll be looking at.
I'd also like to add that there will be, of course, language in the RFJ that the Tier 2 project must meet the eligible scoring requirements, right? So yeah, Anyway, that's all.
Thanks, Lisa. Yeah, Courtney Fultner again from Oregon Health Authority. So I'm going to discuss the review and selection process. And just as a reminder too, this is something that we talked much more in depth about with the ad hoc work group than the details that we'll be sharing today. And I guess while I have the floor, I would also like to just again express my deep appreciation and gratitude to the work group members for their time in kind of getting us to this point in our process. And so just to kind of go over the review and selection process, we will be using a three-step review process. We've already discussed quite a bit of these components already today, but just to kind of reiterate some of the things that we've already talked about, the first step will be the eligibility screening using the eligibility criteria that Lisa went over earlier today, and just kind of ensuring that all applicants first meet that eligibility criteria before they advance to step 2 and before their applications are actually received and reviewed by OHA. And so within step 2, the process that we're considering is that each application would be reviewed and scored by at least 2 subject matter experts within OHA. And they would be reviewing and scoring them independently. And when I say subject matter experts, that's kind of where that funding category designation comes into play again. And so subject matter experts for primary prevention will be reviewing the primary prevention applications and so on. And so as we've discussed, we will be setting a minimum scoring threshold for applications to be advanced to step 3 consideration. It will frankly be a pretty high scoring threshold to move forward because we do again anticipate a lot of applications. We anticipate a lot of very high scoring applications. And so the kind of like highest within step 2 will move forward to step 3. And that will be the core team review and selection process. And so the core team will be comprised of our OHA opioid settlement implementation team members. So the folks that you see here every month supporting the administration of the board. So we will be the step 3 core team where we will come together and do an additional review of the applications within step 3 and then select them based on what we know to be the board priorities based on all the things that we've discussed today and in past meetings. And so step 3 is really where these funding minimums that we've talked about will come into play. This is where the kind of disbursement across different state regions will come into play. And we'll also be considering impacted populations as well as distribution across the continuum. And so we will be very, very transparent about this within the RFGA itself. This is a process that our agency has used quite a bit in previous RFGAs as well. I guess I just want to acknowledge that I think step 3 can feel a little like squishy, but this is kind of why we are wanting to have such in-depth conversations with you all about your priorities and really kind of ensuring that the highest scoring applications based on the rubric are considered for step 3 and will be selected based on these priorities that we know of the board. I'll pause to see if there's any questions or comments around that.
Any questions about the recommended selection process? Joanne?
I'm just wondering because I didn't hear clearly. Maybe I missed it in the discussion. How, if in any way, will board representatives from the board be involved in the review and selection process?
Yeah, thank you for that question, Joanne. So we have been advised by the Office of Contracts and Procurement to have an internal only selection process for this. And so this is kind of the involvement at this point is us kind of clearly hearing and understanding your recommendations and your priorities. And so it will be internal to OHA for steps 1, 2, and 3 for the selection. We will come back to the board to present the applications that we have selected to fund. I don't think that that would be a review, or I don't think that that would be a request for you to approve it, but just kind of presenting to you what has been selected at that point. And so, yes, I guess to long story short, board members would not be involved in the actual review process itself.
Any other questions or concerns? Are there any objections to,
Can
oh,
I just,
Joanne?
can I just make
Yeah.
a comment? Because the nature of the board and because it's a representative board, I would imagine that after the review and selection process goes on, is completed, that board members may get questions about why particular grant applications were not selected or were not prioritized or whatever. So how would you recommend that the board handle those questions? Because we'll establish the priorities and the criteria, but won't be involved in the selection. So it would be really good to have some advice on how the board might handle those questions.
Yeah.
Want me to
Lisa,
jump in?
do you want to? Oh, sure.
Yeah. Well, I just do want to share. I can understand that that is a very difficult position, Joanne. And I do want to say one of the most painful things about running a grants opportunity is that not everybody receives funding. And we have received a lot of feedback from the public, positive and negative, for previous opportunities. And one thing we can commit to, and we have done in the past, is being absolutely transparent about the scoring rubrics. We share after the process, we share the rubrics with all applicants, both selected and non-selected. And we require our grant reviewers to document extremely well why they are scoring in a specific way. And I would say that, there was just really tight criteria, and OHA is happy to meet with you one-on-one to discuss it more, but we will also email everything out.
Yeah, thanks. Thanks for that, Lisa. I guess the only thing that I'll add is that I think that, $13.5 million seems like a lot, but across all of these different funding categories, it's going to feel like it goes fast. And so I think the reality of this funding situation is that we will have very strong applications that unfortunately won't be selected for funding, just kind of given the limited funding amount. And so we are preparing for that. And as Lisa said, are ensuring that we're putting processes in place to be as transparent about our decision making as possible.
And something we've done with a previous grant opportunity was we actually sent out surveys to the applicants who were not selected for funding and asked how we can improve next time. And, we really do look for feedback from both awardees and non-awardees to improve as we go. But yeah, it's painful.
Other thoughts about this?
And everything we do at the state is public record, right? It's all subject to public records requests. And so one of our guiding principles is if this were on the front page of the newspaper, would you be able to back it up and justify it? So we really do our very best to try to make sure we're making rational decisions based on the criteria. But yeah, you can only do so much. But we're always looking for ways to improve, and I love feedback.
So I'm hearing, Lisa, that or Joanne, that if board members do get questions, that you will be prepared to answer those questions.
Yes. Yeah.
Okay.
Yeah. And that can look like emails, one-on-one meetings. We definitely do all of that with the public.
All right. Are there any objections to this review and selection process as recommended by the ad hoc working group? All right, then I think we can move on to our the final recommendation of the ad hoc working group, which is about application questions and the scoring rubric. And this will be Courtney once again.
Yep. Thanks, Jenny. Okay, so in terms of the applications and the scoring rubric, I know we've kind of indirectly discussed this a little bit already today, but applicants will respond to 8 questions that will be scored as part of their project narratives. There will be a series of non-scored questions. Also, in addition to this, such as like selecting your strategy, describing more about your organization, but there will be 8 scored questions within the project narrative. And then applicants will also be required to submit a budget and a work plan. And then, as we've discussed earlier, if they will be naming an additional kind of like external partner who will be also supporting their work, they will be required to include a letter of commitment from that partner. And we will be providing templates for the budget, the work plan, and the letters of commitment. OHA will score the project narrative and the work plan components using a 3-point rubric. And the rubric is really focused on does this response meet the question criteria? Does it partially meet it? And then, or does it not meet it at all? And I will say that we've put a lot of thought and a lot of work into the rubric already to really do what we can to ensure that the rubric is evaluating alignment with the board values, feasibility of actually being able to complete the project, organizational readiness and community need, as opposed to actual like grant writing. And so there's a lot of different rubric development strategies that we've been using to ensure that the focus of the rubric is really on those components as a way to again, support the types of organizations that may not have previously received OHA funding or smaller organizations that don't have extensive grant writing experience. And then in terms of the budget and the letters of commitment, we will be using a simple kind of pass-fail criteria to just kind of ensure that what we have indicated as requirements for those are met. And so the rationale for this process is, again, to support a low barrier application process that prioritizes readiness and likelihood of project success over specific grant writing abilities. Any questions for Courtney? Julia?
I guess I think this sounds good for a low barrier, but I'm concerned that you're not going to get much disparity or diversity in scores. And is that going to actually give you a meaningful ability to weed people out?
Yeah, thanks for that question. That's also something that we've been considering as well. And so I think that kind of goes back to that 3-step review process that we were discussing earlier. So just kind of ensuring that applications that seem feasible and in alignment with board priorities advance to that third step so that our core team can then select what is funded based on the minimums that have been established by the board and the priorities that have been established by the board.
Did that answer your question? Okay.
What is the scoring for that? Sorry to jump in
Yeah.
without a hand. I had the
Jump in.
exact same question, just related to the 3-point scale, like potentially not having a lot of like real delineation between the scoring of the applicants. And so I guess for public transparency's sake, that third step review, like how would that be scored, and what would the documentation around those decisions be for the community if there wasn't a lot of delineation as far as who the process of getting to that third score? If there was just a lot of folks that were having a lot of threes throughout, meeting that low barrier, but potentially still not being selected.
Yeah. So these are great questions. Thank you all for digging deep with us on this. And so I think that essentially we're kind of getting at the priority populations and how that will really come into play with that additional point. And so right now it's kind of assuming that there will probably, the threshold is that applications that meet criteria and expectations will advance forward. And then the priority population point will be just one extra point. And so this process will kind of ensure that, I'm trying to this is a very complicated thing to explain, but any application that meets all criteria and expectations will move forward to step 3, regardless of whether it is supporting a priority population. But that extra point for the priority population will help it advance to step 3 for consideration for our team. And so in terms of us documenting how we're making those decisions, it's another round of review where we will be considering, again, kind of innovation, community need, priorities of the board, and we will be documenting all of that decision making. But it's going to be an extensive review process, and also just kind of, again, considering the priorities of the board as we're making those decisions.
And I'd also like to add that all of this will be in the RFGA itself. So there will be no hidden criteria that people don't know about, because there's no way it would pass DOJ review if we had additional criteria that's not mentioned in the actual grant materials. So we'll be very, very clear about what we're looking for.
Yeah, Julia.
Yeah, can you speak a little bit more about, or maybe I missed it, the budget pass fail? I guess I'm curious, what you're looking for to make it pass or fail.
Yeah. So the budget pass fail is essentially, does it only include allowable expenses? Here, I can actually pull it up and refer to it. So I'm giving you accurate information. Does it align with the project scope, work plan, and estimated number of people served? And then does it clearly justify the spending categories within the budget?
Sorry,
and these budgets are considered drafts because if the proposal is selected for an award, then there's a process with revising the budget during contract negotiations.
And if the budget fails, does that automatically stop it, or does that it does?
Yeah, it does. And another consideration that we've kind of included, as Lisa mentioned, since there are budget negotiations, is that it's okay if budgets include some errors, because we know that that just happens sometimes. And so we're not including that as like a very strict criteria because we will be doing that negotiation. And so just kind of ensuring alignment with the project as proposed and then ensuring only allowable expenses.
And each of those criteria have a score, have like a point. It's not like you have to meet every single thing to move forward.
Other questions?
Also, the rubric includes a strengths and weaknesses section, and reviewers are required to address that in the rubric if they are asked to provide feedback about the application. So just document, document, document.
Yeah, so it's about aligning with priorities. Okay, great. All right, so this was the recommendation of the ad hoc work group. And, with those clarifications, are there other concerns about moving forward with this recommendation? Are there any objections to moving forward with this recommendation? Okay, so that was the final recommendation. And Courtney, yeah, thank you everybody for thank you first of all to the ad hoc working group who worked so hard to put together these recommendations. And thank you for all of your thoughtful questions as board members as you considered these. And I will let Courtney go through the next couple of slides, which are just sort of checking the work that happened against the OSPTR board priorities.
Thanks, Jenny. And just to echo Jenny's gratitude, thank you all for your questions and your considerations today. So just sort of revisiting the priorities that we've been sort of using as our North Star in planning this RFGA process. Just kind of wanted to walk through and demonstrate how we have incorporated this into our planning. So funding the full care continuum. Again, we will be implementing Tier 2 funding category minimums to ensure funding across the continuum, specifically for those larger scale projects. Having open eligibility for organizations that meet the requirements to apply. Again, noting that only state agencies and tribal governments and entities outside of Oregon are considered ineligible. All other types of organizations are eligible and welcome to apply. For broad geographic distribution, we've discussed how we will be having funding minimums for specific regions across the state, and also will be prioritizing rural and remote communities as part of our priority populations. Encouraging innovation. This is something that we are incorporating within the RFGA, where we are welcoming projects that are considered innovative. This is something that we will emphasize in the open office hours and also the RFGA webinars that we'll be hosting once the RFGA opens. And then in terms of the application questions themselves, there will be a question asking applicants to describe how their questions are either evidence-based, community-informed, or innovative, and those will be kind of equally weighted in terms of priority so that we can, again, encourage innovation. Next slide, please. For a transparent and low burden application process, again, applicants will be responding to 8 project narrative questions. There will be a paragraph and a character limit for those questions. Those types of details are still to be determined, but will be incorporated within the RFGA itself. so that applicants know what to expect when they apply. We will be publishing our RFGA application materials in English and Spanish, as well as hosting Spanish-specific webinars and office hours for Spanish-speaking individuals that are interested in applying. Again, mentioning the rubric and how the rubric will be considering project feasibility and alignment with priorities. And then also just wanting to reiterate that all the work that OHA does is considered public record. These are all public meetings where we've been discussing and making these plans, and all of the meeting materials and the recordings are available online on our website. And then finally, the priority to reach organizations who have not traditionally received state dollars. We are developing a really comprehensive communications plan that will prioritize broad outreach, specifically wanting to prioritize outreach to, again, application or organizations that haven't previously received funding, as well as priority populations. And there will be a non-scored question within the application asking applicants if they have previously received OHA funding. And this will be a way that we kind of looking back and assessing our ability to reach these organizations. I believe that's it. So back to you, Jenny.
Yeah, I think that takes us to our public comment. But first of all, are there any questions for Courtney on that, the checklist against the priorities that she went through? Okay. So that takes us to public comment. And so I'll hand that off for Carrie.
Okay, well, before we dive into the public comment section, I just want to again express gratitude, as many have, for the work of the ad hoc group. And it's very exciting to be at this point in time and to have this process continuing to move forward. So I'm really looking forward to continuing down this path and getting those funds out to do more great work. So my understanding is we don't have anybody that signed up for public comment. Should I still read this?
I don't think you need to, Carrie. Yeah.
All right. So, but I do want to remind the board that we did receive 2 letters of public comment from an organization called Alliance for Kids. One was in the meeting packet and one was sent, I believe, this morning or yesterday in a separate email. So, I just wanted to remind you all that we did have those. So definitely want to take a look and make sure that you review them.
And the new letter is in the new version of the meeting packet that I attached this morning to the meeting.
Okay, perfect. Yeah, so yeah, next steps. I'm going to go ahead and turn it back over to OHA to just kind of highlight some of the next steps that will allow us to keep this work moving forward. I think Carol's taking those. Thanks.
Thanks, Carrie. Now that we've received approval related to the priorities and overall direction, we will walk through the plan, next steps, and the anticipated timeline. Beginning in mid-August, OHA will finalize the draft RFGA and submit it to the Office of Contracts and Procurement. That may be a little bit delayed after today's meeting, but during the same period, OHA will also be developing the application submission form so that applicants have a clear and consistent way to apply. From October through December, the RFGA will be open. During that time, OHA will host informational webinars and host open office hours to provide support and answer questions from communities or applicants. Between January and April 2027, OHA will review all submitted applications and select the grantees. In May and June, OHA will move into contracting with or setting up agreements, because these are grants, with the selected grantees, and then we'll present the final list of awarded grantees to the board. And finally, the tentative project start date for funded work is July 1st of 2027. This timeline gives us a clear roadmap of the work ahead and outlines how we move from board approval into implementation.
Thanks, Michelle. And Courtney, I wonder if you could, if you have thoughts on how the continued work on the priority population is going to impact this proposed timeline.
Yeah, thanks, Jenny. I don't know if I can answer that question right now. I think we might be able to. Okay, so I guess to back up, our typical process is to submit to the Office of Contracts and Procurement, and once they review and approve, it's submitted to the Department of Justice. However, I think what we may be able to do is have some pre-consultation with the Department of Justice to specifically discuss the priority populations so that hopefully we can get it in a good place so that when we submit everything, once it gets to the Department of Justice, there won't be any hangups with that. And so it will be a more iterative process, hopefully, instead of a sequential one. And so we will be able to provide an update on that when we come back for our September meeting.
And I'd also like to give a shout out to Stephanie Morgan, who is our liaison with Office of Contracts and Procurement, because she's already raised this topic with DOJ. She's very good at pointing out where things might get sticky. So stay tuned.
Oh, thank you so much, Lisa.
All right, thank you. Okay, so the plan for, or the rough plan for our upcoming board meetings then, on the next slide, yeah, this slide. So in September, as mentioned earlier, there will be a presentation on the mapping recovery proposal. And then we'll also hear about progress on the RFGA. We'll also hear, I think I heard that in October we're going to do an impact evaluation proposal, so a presentation there. And also in the coming months, we will talk about program monitoring, and we'll hear from funded recipients from our previous process. So those are upcoming topics. If you have things that you're interested in hearing about, please reach out to Lisa as well. And I also wanted to just remind everyone, this was early in the meeting, relatively early in the meeting, but Annalise put out an invitation to all board members to join the ADPC work group that is going to be taking on that evaluation and data systems work. I'm sorry, the data systems work. So if you would like to join that work group, please reach out to Annalise. And on the next slide is there a question, or if you have any questions, here's contact information for the OHA staff we've heard from today. So with that, thank you, everybody. This was a lot of information to go through. I really appreciate your time and the work that you put into this, and again, to the ad members, the work they put into making these recommendations, and OHA for supporting that process. So with that, we get to leave 20 minutes early, a little bit early on your Wednesday afternoon. Thanks, everybody.
Thank you, everyone.
Thank you.